I'm proud to say that I'm a patient advocate, and one of the reasons why I feel like it is such an important part of my life is that I do feel comfortable talking about my ostomy, and I realize that not everybody else does. So I feel like it's almost an obligation that I share my story and speak and be a voice for those who maybe aren't as comfortable speaking out loud. Part of advocacy for me, I live in Washington, D.C., so I've had a great opportunity a couple times to lobby on the Hill and speak directly to representatives, share my story, and make a personal impact to tell them about why it's important for the government to provide good health insurance for people, insurance that is cost-effective, and making sure that there's protections for people with ostomies. For example, nobody should be discriminated at work, at school, within the religious community for having an ostomy. These are all important things to be fighting for and striving for. Luckily, a lot of this is available these days, but it's important to continue talking about it so it doesn't get taken away. Another important part of advocacy is just to dispel any kind of myths that people have about living with an ostomy, and that really people can live vibrant and fulfilled lives with an ostomy. And so it's not just being an advocate and speaking to government people, but it's also being an advocate in the community and talking to family and friends and just the general public about what it means to have an ostomy and why there really shouldn't be any kind of a stigma related to it anymore. I think that being a part of advocacy is just another step in the process for me about talking about it more, talking about my experience more, and it's kind of helped me to give purpose and a higher purpose to why I am where I am in my life right now. So if you have any questions about advocacy or want to talk more about it, comment below and let's start a conversation.